Hi, this is Dr. Walker, and welcome back to the channel, denwalker.com. So today I'll talk a little about zinc. Lots of questions online about how to take zinc and so forth. So zinc, you've seen me talk about zinc in the past, looking at how well it works against things like COVID and viral replication in general. And I talked about zinc and kerosene really working well together. Sort of one being the bullet and one sort of being the gun, and the fact that zinc needs to be transported across the cellular membrane into the cytoplasm where it begins to take its action, usually transported by one of the ionophores I mentioned before. Specifically, the one I talked about in the past had been quercetin. Okay, but then the other issue came up was how much zinc do you take? Now, zinc by itself is not well absorbed by itself, and so it's typically attached to some material. Typically, it's what's called a chelator, and that could be like zinc gluconate, that could be zinc acetate, that could be zinc sulphate. Any of those things, it's usually chelated to, and it depends on which of those chelating agents works best for you. So, in other words, some people try the zinc sulfate and it upsets their belly a little bit more, or they'll try the zinc gluconate and they'll say that doesn't work for them so well. The zinc oxide is sort of the big one that I typically tell people to stay away from because it's not easily absorbed by most people. So again, the chelator that it's attached to helps with the absorption process for the zinc. Now, if you look at what I talk about sometimes, looking at either the FLCC protocol or looking at Dr. Zelenko's protocol in terms of how much zinc one should take. There's a discussion about somewhere between 40 and 60 milligrams of elemental zinc, which should be taken, sometimes people say prophylactically, or if they have an infection, it's even higher than that in terms of how much zinc to take. Now, remember, zinc is in the process of doing the battle or the fight against the virus, and so it's being used up all the time. So you have to replace the zinc. So in other words, you got to take zinc sometimes once or twice or 3 times a day based on how much zinc you're trying to take. Now, here's the point. Because it's chelated, the amount of zinc, elemental zinc you get in a capsule is different for all the different chelating agents. For example, I think zinc gluconate is only 14.3% elemental zinc, which means that with every 100 milligram of zinc you take, only about 14% of that zinc is elemental zinc. So if you want to get 50 milligrams of elemental zinc, you got to take 3 times as much of that, 300 milligram of that zinc, to get you close to that 50 milligram of elemental zinc, right? So the other one would be zinc chloride. Zinc chloride's 48% elemental zinc. So again, each 100 milligram of zinc chloride you take has 48% elemental zinc. So you got to do the math when you do this. And so I think for most people, if you're taking it just prophylactically and you're fine, you're not unwell, taking less than the 50 or the 40 is probably okay. But if you are sick though, then you need to do the math, find which zinc works best for you, and do the math and get up to that number that Zelenko tells you to get up to, that 40 or 50 milligram of elemental zinc, in order for you to do well and feel better quickly. And again, zinc is always on the fight in terms of fighting against sort of viral replication inside the cell, but you need to have enough of it for it to do its job and do it effectively. So anyway, thanks for listening, Dr. Walker.